Welcome to Longevity Live. Today is Thursday, September 18th, 2025. My name is Dr. Priyank Sharma. You can call me Dr. Pri. I am your host, and we'll be talking about weekly updates in what's been going on in longevity from a practicing longevity doctor's perspective. My practice is Vita Veda. You can find out more about us at vitaveda.health. There'll be a link in the show notes. And if you get value out of this, please like and subscribe it, share it with someone you love. And please leave me comments about anything you'd like me to discuss in future episodes. I love hearing from you, love hearing about what's on your mind. Really, the purpose of Longevity Live is to get you more longevity information from someone who's doing it day in and day out and understands the nuances. So with my caveats out of the way, let's kick it off right away. I'm going to share my screen here and jump into the longevity hotline. The idea here is that we find some people who are posting their longevity questions and we go ahead and answer it for them. This time we went to our cholesterol to find a question here. So this user, abject mastodon, had a question, really a little bit of a statement. So they're a 39-year-old. They have an elevated LP(a), quite a bit elevated. I like to see these. Well, this is reported in nanomoles per liter, and that's actually a great talking point. Make sure you normalize for the right metrics, the right units for these. But we like to see these below 30 milligrams per deciliter. That being said, this person is assessing their lipids. This is our cholesterol after all. And they didn't really get their lipids checked before they were 34, but the first time in their early 30s, they were pretty high here on their apolipoprotein B, I believe it was. He doesn't say which cholesterol, but it might be his LDL cholesterol, and then he or she got put on statins. They're taking 10 milligrams of rosuvastatin, have worked on their diet, and their LDL is quite a bit lower. Actually, really surprising response here with only 10 milligrams of rosuvastatin getting their LDL from 160s to 190s down to 50s to 70s. But they do have this elevated LP(a), and so they're curious about the risk there. They shared some of their data from a coronary CT angiogram and a carotid duplex ultrasound. So, he puts himself at high risk due to this LP(a), and there's a few things I wanted to talk through. Normally, when we're doing this, I'm actually answering a question. This person didn't have a question, but I think there's a lot of interesting, instructive things to talk through here in general. And this, of course, it's a hotline, so I wanted to start with some advice. These results are great news, and since the type of imaging that this person has undergone is really the gold standard for assessing cardiac risk, I would say we are feeling very good about this person's at least short-term risk. We obviously don't know what's going to happen in 30 years, 50 years, a lot could change, but at least in the short term, things are looking good. So what exactly happens in your blood vessels to increase risk? There's a fantastic article here from Peter Attia that I refer to a lot of my patients because he's got some great visualizations, and I'm not going to go through all of the text here. But what he's showing you is that early on, the disease process that clogs up your arteries, it happens in a microscopic level and you can't even really see what's happening. Now, we know what the main factors are that influence it. There are the apolipoprotein B and the cholesterol particles that contain that apolipoprotein B, which is a protein used to carry the cholesterol. And the biggest offender are these LDL cholesterol particles, low density lipoproteins, which you've probably heard of. So that's a big factor. Inflammation is a big factor. A lot of which seems to be driven by high blood sugar. And obviously having high blood pressure impacts all of this as well. So all of these are risk factors, and I won't go through all of this, but the point being is that this process is starting a long time before you can see it anywhere. And this is why we're so focused on those cholesterol molecules, because if you reduce the number of those cholesterol molecules floating around, you reduce the interactions with the blood vessel wall and eventually the disease process. But what I wanted to show you is here towards the end, if your essentially this cholesterol gets into the wall of the artery and your body at some point can't get rid of it, so it walls it off. And it does that through a process called calcification, which is literally calcium deposits. And you hear about this a lot with coronary calcium scores as a new thing people are doing in order to to determine their kind of cardiac risk status. But I want to point out that this is an end stage thing to do. Now, the benefit of a coronary calcium score, I'm going to flip over to this worksheet here, this educational sheet that I share with my patients. So the benefit of a coronary calcium score is it's cheap. It's about $100 in the US. You get some radiation, but you don't need anything injected in your veins. It's easy to do, right? And it tells you, it'll show you if you have some of this end stage atherosclerotic or blood vessel disease going on in your heart. The downside is it only shows you end stage, and you could have something what's called soft plaque, which is earlier on essentially getting an outpouching of your arterial walls, which narrows the space that the blood can move through. Now, in order to see that, you would need to get a CT angiogram, or what's called a coronary CT angiogram, CCTA. And if you kind of zoom in here, you can see that what happens is they inject dye into your veins, which makes it a little bit more invasive, a little bit more expensive. Now we're getting into the $600 to $1,000 range. And when you inject that dye, though, you can see literally how much space there is in the blood vessel walls. And this is what a cardiologist will do if they are doing a stent on someone as well. So what's my point? My point is this is a better study. This is, I would say at the moment, a gold standard, because then you can really see what's going on, and you can see if you have any narrowing that does not come with calcifications. There are people who have heart attacks that have a coronary calcium score of 0. Bringing it back to this Reddit user, they did that. They did just that. They did the coronary CT angiogram, and which, by the way, when you do that, they'll already give you a calcium score with it. So you kind of get a 2-for-1. And so it looks like they've got a really nice, clean bill of health. And, at this point, I don't think you necessarily need to stress about your LDL cholesterol level. And by that, I mean, if you have a high LDL cholesterol or a high ApoB, but your coronary CT angiogram is 0, or, it's showing no narrowing at all, and this person shares some of their reports here. Here's what you're looking for. They go through every single one of the arteries in the heart, and it says no significant narrowing, no plaque, no significant narrowing, no significant narrowing, etc., across all the major arteries on the heart. Well, that's fantastic. That's exactly what you're looking for. I would say this person has very little short-term risk. Now, how do you make sure that you're not building up more plaque? Well, you probably want to get this test repeated. And if it were me, I would probably go get one every 2 years. We don't exactly have data on what's the best interval to do this for. It's a little bit up in the air. And then at that point, you can decide, okay, do I want to keep my LDL cholesterol low? Do I want to lower it? Or am I okay where I'm at? Is my current steady state good enough to prevent that disease from building up? This starts to become a little bit of a personal choice. Again, I would continue on the cholesterol lowering therapies. I want to keep that LDL, that ApoB, as low as possible, because heart disease is a major risk factor for most people, and certainly in my family. But that comes down to how do you want to manage your risk? And with all things in longevity, it's a little bit about how aggressive you want to be with that, and somewhat of a personal decision. And a good longevity doctor will not tell you, hey, you should exactly do X, Y, or Z. They'll tell you, hey, if you stay on this path, it's really risky, or it's not. Choice is still yours, but the job of the doctor is to inform you as to what that risk is. So just to summarize here, the few key points. The coronary CT angiogram is the gold standard, and regardless of what your coronary calcium score is, or your ApoB or LDL values, this is what matters the most. If some cardiologist is going to operate on you and open up your arteries, that is what they're going to look for. This is the best data you can get out there. Okay. One thing I didn't touch on, but I'll touch on quickly, is this person also got a carotid duplex. That's where they take an ultrasound and they look at these arteries here in your neck that are going up to your brain, and they try to see also, is there cholesterol there? Now, the theory there is that if you have a narrowing due to cholesterol in one part of your blood vessels, of your arteries, it'll be the same throughout. I can't tell you how validated that is, but it is a much easier test to do. I probably would still get the coronary CT angiogram if I want to be 100% sure of what's going on, but just know that that is an option out there. And maybe you have a clean coronary CT angiogram and you monitor the carotid ultrasound every 6 months or more frequently, depending on, again, how much you want to monitor. But it's less invasive, easier to do. Okay. Third point I want to make is this patient, although having this elevated LP little a, which by the way is genetic, there's not a lot we can do about it. And similar to ApoB, it does cause the atherosclerotic disease. But I wouldn't say that they are at super high risk in the short term because of the fact that their coronary CT angiogram is clear. And then finally, all this comes down to risk reward. So we'll link all this to the show notes. Hope you found that helpful. Abject Mastodon, great job, doing a really good job of keeping on top of your atherosclerotic cardiovascular risk. And right now, everything's looking good. So I want to say kudos to them for that. That is the longevity hotline for today. Let's move on to some news stories. All right, we got Martha Stewart here. And I actually want to start off by saying I'm not going to talk so much about this specific article, but I think there's some interesting things to think about from a longevity standpoint here. Now, and I will also say I actually agree with a lot of what's in this article. I do think that we'll start off, they're talking about the eight best drinks to support healthy aging, the last of which is water. Completely agree with this. And look, in general, I think if you take these categories at a high level, I agree. Black tea, green tea, coffee, herbal tea, bone broth, and kefir. I think that's all of them that they listed here. All right, but the devil is a little bit in the details. And I want to also talk really about how you can do your own due diligence from a longevity and health standpoint and kind of show you how I think through some of these things. So one thing that kind of puts up my antenna a little bit here is that this is the best drinks to support healthy aging according to nutritionists. Now, I want you all to know that a nutritionist is a self designated title. Okay, there's no such thing as an accredited nutritionist. Anybody can say, I am a nutritionist. Now, does that mean that every nutritionist has no idea what they're talking about? No, not at all. Some of them know exactly what they're talking about. But just know that there's no training required for it. So who are the nutrition experts? Well, in the US, they're called registered dietitians. So that term dietitian is what you want to look for. They go through a training program, they go through a certification process. The shorthand for them is RDs, registered dietitian. Right. So again, not that a nutritionist doesn't know what they're talking about. It's just we can't really take anything from this label nutritionist and get any information from it. And I find it a little bit strange because this title is trying to say, hey, you should believe us because a nutritionist told you about this, or multiple nutritionists. But that's not a title that really means anything. So why are you appealing to authority there? Again, I actually agree with a lot of what's in this article. So that's because I'm familiar with these different drinks they're talking about. But just wanted to point out the difference between a nutritionist and a dietitian to you all. Okay, so the other key part of this article is looking at the nutrition label. So when I said categorically, sure, kefir could be good for you. A lot of times it is. Well, it kind of depends. What do they put inside of it? And most of you are probably familiar with looking at nutrition labels, but if not, let's just take a quick look. All of these are standardized. This is government regulated by the FDA. They have to disclose what is inside of the product that you are consuming. Okay, and a few things that I want you to always look for are sugars, right? And recently, within the last 10 years, I believe it was, maybe 20 years, all products have to note how much added sugar there is. So sugar that would not naturally be within the ingredients. Okay, then protein's a big one, and dietary fiber is a big one as well. Sometimes they split this out into insoluble and soluble fiber. I think in the future we'll be seeing more of that. So whether or not green tea or kefir or even water is good for you is, well, do they add sugar? Right? So we can't just like categorically go with these things because these food companies are smart. They know people like sugary things. They know it's addictive. They'll add sugar to most things. Your bread probably has sugar in it. So go ahead, take a look for that. It's trust me, I've looked. It's very difficult to find bread that doesn't have sugar in it. So just two things to keep in mind from this article. And registered dietitian versus a nutritionist, and do your own diligence. Take a look at these nutrition labels. You will be This is a small little hack that makes a major change in your diet. I can promise you that. And also make sure you look at the ingredients. If there's a bunch of stuff in there that you don't understand what it is, it's not a fruit or a vegetable or, an ingredient you've heard of, then, you might want to be a little bit more cautious or skeptical with it. I know that I am. Okay, now on the business side. So I enjoy the business side of longevity very much because of my background in business, but also, especially when it comes to tech, we get a sense of where the industry is going. And here we have 8 Sleep. So this is Fierce Healthcare. It's not an 8 Sleep press release, but 8 Sleep is they call it a tracker, but really designed to help you sleep. It is a cover that goes on top of your mattress, and it records some of your metrics, and through your movement patterns it can kind of tell you how much deep sleep or REM sleep did you get. That's how all these work, by the way, whether you have a Whoop or an Oura Ring. It's all about like how much you're moving. That is not quite clinical grade, although these folks are starting to get there. If you get a clinical sleep study, they're going to put electrodes up to your brain and actually measure your brain waves to determine which phases of sleep you're in. But obviously, that's not super convenient. People don't like having things on their head when they sleep. So, a little bit of pick your poison here. But 8 Sleep, really what they do is they cool you down and they help modulate the temperature of your bed over the night. And that really helps you sleep a lot. You typically want it a little bit colder when you're sleeping. And then as you start to wake up, you want it a little bit warmer. It's actually a cool product. I don't have one. Can't afford it at the moment. So, if you're listening, 8 Sleep, go ahead and hook me up. But the way that it also works is you can split it. So the temperature on one half of your bed is different from the temperature on the other half of your bed. And that's really cool, especially for those of you who may have a partner like I do who sleeps at a different temperature. Anyways, so that's a little background on what 8 Sleep is, what they do. And they just raised $100 million, which is super cool. But it begs the question, okay, so what are they going to use that money for? Are they expanding? What else are they wanting to do? Well, if you read through here, really what they're trying to do is they're trying to use all the data that they've gathered on people sleeping. They said over 1 billion hours of data, and see if they can use that to further optimize sleep. And even more ambitiously, they're talking about getting into the clinical realm and get FDA cleared as a medical device for different indications. I suspect where they will start is with sleep apnea, because this is a really widespread problem. A lot of people have sleep apnea, and the way to diagnose it is through these sleeping movements, as I've mentioned. And there is a little bit of a precedent for this. Oh, sorry, I'll get this out of the way. There's a company called Happy Sleep that a friend of mine it works at, and they have a small ring you can see here. It's an Aura ring type of device, but it got FDA cleared to be a at-home sleep study. And so what happens if you think you're at risk of having sleep apnea, you take one of these sleep studies and it records the number of times you basically hold your breath or completely stop breathing. And if that hits a certain threshold, then you are diagnosed with sleep apnea. So my guess is that's where 8 Sleep is going first, but we'll have to see. And I think it's really cool to kind of see this expansion of detection of disease, because that's a huge part of prevention. And as an FYI, I would be remiss not to mention ChiliPad, which is another really good alternative to 8 Sleep, a great alternative to 8 Sleep, in the sense that it's another pad that cools down your bed and helps you sleep. Okay. Next, I wanted to talk about another healthy 80-year-old who attributes their health to their habits, or attributes habits to their longevity, I should say. And this was a cool article found in the Washington Post. I wasn't able to see it all, so I wanted to show it to you. But a couple things I wanted to point out here. Great quote here. You don't stop lifting when you get old. You get old when you stop lifting. Still bench presses 55 pounds, which is not bad for, did I say 80-year-old? She's 90. Not bad for a 90-year-old. And leg presses 250, which is also great for someone of that age. And the other thing I wanted to point out on this article, I want to bring more examples to you all of people who are old and staying very active. I'm very look, no one's going to know for sure, and we're going to find out in the next decades. But there's this concept, this idea out there that to live to 90 without disease, like this lady in the article, Miss Tro, or Trax, Truox, I'm sorry, I don't know how to pronounce it, but to live to that age requires exceptional genetics. And I'm just seeing many examples that say otherwise, right? And why does this matter? Because if you think there's nothing you can do to get to 90 without being, having a lot of heart disease or cancer, then maybe you're not going to try right now. But I don't think that is the case. And this article also talks about a book called Super Agers by a renowned cardiologist, Eric Topol. And what they found is that the commonality between people who lived for a really long time without disease. Again, the key for longevity is to get to your 90s without disease, not to get heart disease in your 60s and limp along. So those people who got to their late ages without having disease, their genes didn't reveal much. The vast majority of times it had nothing to do with their DNA. And I love Peter Attia. I showed an article of his before, but this is one place where I really disagree. I think he's reading the data wrong. He keeps telling folks, well, no, people who live to their 90s without any disease, it's really just the fact that they have DNA, and we don't know exactly what it is about the DNA. We haven't found anything in the DNA, but it must be the DNA. This is a counterpoint to that, and I think we're going to increasingly see examples of that. So I wanted to share another one with you so you don't give up. Don't stop. You're going to get there if you want to. So for those of you who do. Okay, next article I wanted to talk about. This was really cool, kind of more on the techie side, no business, just tech. Wi-Fi signals can measure heart rate, no wearables needed. It's just a really cool technology. They're calling it PulseFi, which is kind of cool, and it has the potential to democratize wearable data. Now, probably the biggest wearable right now is called Whoop, and if you look into it, I was thinking about getting one for a family member. It's $25 a month at minimum. All right. And sometimes some of them that don't have as much of that subscription cost, they're something like $200, just $200 just to get the device itself. So they're not cheap. Love to see this. Love to see, again, the democratization of getting that data out there and helping us detect disease earlier. Now, the last thing I wanted to talk about with you all today is biohacking amenities that healthy home buyers are buying right now. Is it worth the investment long term? So this is, I love this because, again, it's showing the trend that people care a lot more about getting their data. I think this is actually a little bit of a misleading title. It's not really biohacking. It's more like longevity amenities. This article talks about folks getting saunas or cold plunges in their houses. And the truth is, these are not insanely expensive. You can get a sauna, outdoor sauna, kind of a cedar wood barrel one for around $5,000. Look, it's not nothing, but your deductible in healthcare is probably $5,000 these days. Right. And it says infrared saunas can run up to 10,000, but up to, it doesn't have to be that much. And I think this goes to show this broader trend in the culture of people really understanding that they should be taking care of their health and investing in that. And I love to see it. Okay. And that is our Longevity Live episode today. Want to just caveat that nothing mentioned here is medical advice. If you're having any symptoms or any medical issues, please go see a provider who knows you and can give you the context that you need. This is all for educational purposes only. If you enjoyed this, please like, subscribe, and comment. Share it with a loved one. Thank you, everybody. I will see you next week.